Welcome, 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 my dear friends. I welcome you all. Myself is Professor Dr. Rajendra Deshpande. I welcome you all in my Ayurveda Academy channel. This is the only channel that is very interested for all the students of Ayurveda, all the teachers of Ayurveda, all the doctors of Ayurveda, and this is also very, very interesting for the common man, for the common patients. Because in this Ayurveda Academy channel, nearly 650 plus videos have been uploaded, which are academic important, clinical importance, and all the way. Everybody is get benefited by this particular channel. So I request all of you, you like this video and also subscribe my YouTube channel. Today we are going to discuss about Charak Sutrasthan chapter 2. This is Charak Purvardha for second year BAMS students and also for everybody because Charak is the best reference book for Ayurvedic science. Okay, so Charak Sutrasthan chapter number 2 short notes for the second year BMS Charak Purvardha by myself Professor Dr. Rajendra Deshpande. I am MD in Ayurvedic medicine, Kai Chikitsa and MD in Ayurvedic physiology, Kriya Shariya. My WhatsApp number is 9226810 Okay. So the most common question asked in many previous question papers, write Shulnashak Yavagu, Shulnashak Yavagu, which will take care of pain. It may be abdominal pain, it may be the body pain, which dietary Gruel, Yavagu you can use. Reference is from Charak Sutrasthana chapter number 2, shlok number 18. Chapter's name is Apamarga, is a plant, herb. Tanduliya, Bij, Apamarga Bij, Adhyay. Adhyay means chapter. Okay. So this is, we will discuss, definitely we will give you the answer of that question, but also I am going to revise the whole chapter in a very fast manner. This is like the short notes for the Charak Sutrasthan chapter 2, Apamargatanduliya short notes. The second chapter is a part of Bheshaja Chatushka, because in our medical practice, first the patient comes to us. Are you understanding? That's why Bheshaja means medicine, and Chatushka, the 4 chapters are given, dedicated for giving you the idea of treatment. The first chapter, in the first chapter, they have started to discuss about Panchakarma or purificatory processes, and some Mulini, Falini, Dravyas have already been discussed in the chapter number 1st of Charak Sutrasthan. This is the extension of that particular explanation. So here also the Charak has explained which plants are very useful for Panchakarma procedure. Vamana Virechana Basti and Nasya. Vamana Virechana Basti and Nasya. Where are the 5? Basti, Niruha and Anuvasana. Anuvasana Basti only oil enema and Niruha Basti is a decoction plus oil. Anuvasan only oil. Okay. So this is a part of Bheshaj Chatushka means 4 group of the 4 chapters. This deals with the list of herbs used in the Panchakarma procedure, detoxification, biopurification process. The treatment is always depend, Charak says, it depends on the dose and time of administration. And how that can be decided? By logical reasoning. Logical reasoning is called as Yukti Pramana in Ayurveda. Logical reasoning, intellectual reasoning, Yukti Pramana. Okay. So the Charak has not given any doses of any plant because he say the doctor, Vaidya should decide the dose, at what time it should be given, because it depends on so many factors. Age of the patient, prakriti of the patient, condition of the disease. Lot of things has to be considered, and then dose and time is decided by the Ayurvedic physician. Okay. Specific dietary preparations, they are called as Gruels in English. Yavagu is a Sanskrit word. This is a part of post Panchakarma regimen. Post, after Panchakarma, Vaman Virechan Basti, after Panchakarma, our Agni digestion capacity becomes weak. Patient digestion is weak, Agni is weak. So that Agni should be illuminated fumigated, slow and step, slowly and step. That is called as a specific dietary plan. Specific dietary plan is called in Ayurveda Samsarjanakram. Samsarjanakrama. Remember this word. Very, very important word. Samsarjanakrama means post Panchakarma dietary plan. The principle is from light diet to the normal diet. From light diet to the normal diet. Light diet is included that particular Gruels or Yavagu. The chapter also explains the different procedures for body purification and diet in healthcare system. Okay. So herbs used for Shirovirechana. The Charak has started with the head and ENT part and ophthalmic part because head is called Ayurveda the most important organ for life, brain. You know, brain death, danger. Brain death, danger. So Ayurveda has said brain is a uttamang, the best part in our human body. Okay. So in order to clean this particular head and brain and all this part, to remove the gaurav, heaviness, headache, shirashula, rhinitis, Ayurvedic word is penis, ardhava bhedak, hemicrania, krimi, infections at different parts, bacterial, viral infections, apasmara, epilepsy, then Grananash, insomnia. This is one of the feature of corona pandemic, corona infection. Pramoha, fainting attack. And in these conditions, if you want to treat these conditions, which nasya, which cleansing plants we should use? Number one, Apamarga, Pippali, Piper longum, Marich, Piper nigrum, Vidang, Embellia ribes, Shigru, Moringa olifera, Ela, Elateria cardamomum, Surus, Ossimum sanctum, Lashun, Shirish, Daruhridra, Jyotishmati, and Nagar. Nagar means gingiber officinale, Sundh in Marathi. So all these herbs should be used for Nasya Shirovirechana, cleansing of the brain. Next, herbs used for therapeutic emesis, Vaman Karma, Vamana. So Madana Phala is the best one. That is, then Madhukam is a Jeshta Mother, Yeshti Madhu, Glycyrrhiza glabra. Sometimes we can use Nimba, Pippali, Kuteja, Hularina antidysenterica, Ikshvaku, sugarcane juice, Madana Phala, 3 grams. Write down. Vacha, 1 gram. And Jeshta Mother, 2 grams. This is called as a Vamaka formulation with honey, Satana. And then you have to drink 4 to 5 liters of Glycyrrhiza glabra or Yeshti Madhu decoction or sugarcane juice or decoction of Nimba. Are you getting? This Vaman is very useful for the Kapha Pitta problem which has an origin in stomach. So that all the Prakupita doshas are taken from the upside. Okay, emesis, therapeutic vomiting. Herbs used for therapeutic purgation, that is Virechana, Trivrit Leha, very famous. Trivrit Leha we always use in our practice. Operculina terpetham, Nishottar. Triphala tablet, best tablet laxative. Don't forget to prescribe Triphala tablet for each and every. Triphala Ghanavati, I use lot of time for many patients. Then Danti, Saptala, Vacha, Acros calamus, Kampilnak, Aragvad Kapilavati is available. Aragvad Kapilavati is available in the market for cleaning of your bowels. Aragvad Bahava is a mild laxative. Simple Bahava, that resin is available, 10 gram, 4 cup water reduced to the 1 cup, and that Bahava Magaj decoction is a sweet in taste and can be used for children and old people. Draksha, Drakshavaleh, Draksharishta, okay, Dravanti are all these drugs called the therapeutic purgation, and they clean the whole body which is vitiated by Pitta dosha predominantly and Kapha dosha secondarily. Okay, so Pakvasha is a root organ where it is get damaged. Next, herbs used for the therapeutic enema, that is Basti in Ayurveda. Patala, Agnimantha, all the Pilva, Agnimantha, Shonnak, Patla, 10 to. Bilva, Agnimantha, Shonna, Patla, 10 to. Shaliparni, Prishniparni, Bruhati, Kantakari, Gokshur. So Bruhatatrai and Lagutrai, which can be used as Dashamula, 10 roots are the best medicine to give the decoction. So Dashamula decoction is very famous. Then what is next? Bala. For nourishing enema, we can use the Bala, Bruhati, Erand. Eranda is a ricinus communis. Eranda taila is a best laxative, best cleansing. Punarnava, Punarnava, giving the regeneration to different organs. Kulath, then Guduchi, Madana, Lavana, salt. Salt is also essential for the basti. Okay, this is all decoction is prepared and used as a asthapana basti. Asthapana basti is decoction enimata. If we prepare the oil by these particular herbs, then that only oil, only medicated oil, if you use for basti, that is anuvasana basti. Anu means after, vasana means food. So anuvasana basti is always given after food. Asthapana decoction basti is given when the previous food is already been digested. Okay. Next, prerequisite of Panchakarma procedure. तानि उपस्थित दोषाणां स्नेहस्वेदोपपादनैः पंचकर्माणि कुर्वीत मात्राकालो विचार्यन्. When the vitiated doshas, first they must bring from whole over the body to the koshtha, that is stomach and large intestine, get by snehana and svedana, oleation and sudation, fomentation therapy. A physician should administer 5 biopurificatory therapies by duly considering, you must attention, matra and kala. What is yukti? Therapeutic rationale. Matra kala shraya yukti. Matra kala shraya yukti. Siddhir yukto pratishthitaha. Therapeutic or rational therapy depends on the dose and the time. Success of the treatment depends only on the skill. Skill, yukti is the skill of the Vaidya. But prior to the application of yukti, the physician should always possess a complete knowledge about the medical herbs. Gruel, Yavagu, for enhancing digestion and colicky pain, Shulagna, Pippali Mula, Chavya Chitraka Nagarehi, Pippali Mula, Chavya Chitraka Nagarehi, Yavagur Dipanya Syat, Shulagni. This question is asked, this question, but we have given all the background of Charak Sutrasthana chapter 2 short note. Okay. Shulagni Upasadhita. Panchakola, so this particular 5 market available medicine, Panchakola, so 4 TSF with equal amount of water for all the complaints of indigestion. It includes Pippali Mula, Chavya Chitraka Shunti. Latin names are given on the script. Okay. All these PDFs, when you want any PDF of any video, WhatsApp Dr. Deshpande 9226810630. Paid PDF is available of all these videos. Okay. This is very useful to stimulate the agni or the digestive fire and cures the abdominal pain or the colic. Gruel for krimi, worm infestation, roundworm, threadworm, tipworm, vidanga pippali mula, shigru bhir marichenacha, takra siddha yavagu syat, krimigni sa suvarchika. Gruel prepared with vidang, vavading, best anti-helminthic, pippali mula, shigru, sheuga, then marich, black pepper, and sauvarchana lavana, black salt, along with the buttermilk is beneficial for treating krimi, anti-helminthic. Gruels for excessive thirst and toxicity. Gruel prepared using mridvika, black resin, mridvika, sariva, cooling, thanda, cool. Sariva, very cooling plant. Laja, popped, sorghum, pippali, madhu, nagar. This relieves the thirst when it is further cooked with somaraj, sorelia, cordifolia, this plant. It acts as an antitoxic, particularly in all types of skin diseases. Gruels for respiratory problems and colicky pain. Gruels prepared with dashamula. Dashamula, 10 root drugs is beneficial in hikka, shwas, breathlessness, and kapha is considered kapha hara, reduces the kapha. The one prepared using ghee, oil, and alcoholic beverages, Ayurvedic alcoholic, alleviates the pain in the colon, shulagna. Okay. Gruels for Catharsis and flatulence. For the Bhedana karma, that is cathartic action, Gruel prepared with alkali, chitraka, hingu, and amlavetas is beneficial. Gruel prepared out of abhaya, hirda, abhaya rishta, pippali moola, and vishwa. Vishwa is the name for suntha, gingival officinal, is vatanulomana. Vatanulomana eliminates the flatus. Gas is reduced. Pavanamuktasana for the gas. And you can use this Abhayarishta, Pippali, Pippalyaso, Panchakarma, so etc. Okay. Gruels for digestion, styptic action, and vata dominant diarrhea to control the diarrhea. Gruel prepared with bilva, bilvavaleh, dadimavaleh are digestive and grahi, take away the water, okay, and promoting the absorption of water. Whereas thin gruel prepared with panchamula is beneficial in the disorders of vata dominant diarrhea, loose motion with lot of pain in the abdomen. So this is all about Charak Sutrasthana chapter 2 short notes, but mainly question was describes Shulagni Yavagu Apamargatanduliya Adhyay. Okay. So if you find this topic very interesting and video is interesting, please like this video, share this video, and ask your friends to subscribe my YouTube channel for getting the knowledge of each and every subject of Ayurveda. WhatsApp number is 9226810630. You can ask for paid PPTs, paid audios, paid videos. You are always welcome. I wish all the best for your exam as well as for your medical practice on for your life. Thank you very much. Take care. All the best. All the